this is to preface what I'm about to say. It applies to the general, to mostly everybody, but of course everybody's different. Not everyone's gonna react the same thing to the same exercise, to the same things that I'm gonna say. So I want you to take that into consideration. Not everybody's the same. Everybody's a little different. So not everything is gonna apply to you, but especially this first part of the presentation I'm going to give is going to apply to everybody. It's going to have something for you to definitely something for you to learn for sure. Whether your pain has been just started yesterday or if it started years ago, everyone can definitely learn something, especially from the first part of my presentation, which will be talking a little bit about what physical therapy is and what pain is. So build in your seats. This might take a little while, but I think having the knowledge to battle what we're going to battle, which are our daily aches and pains, it's almost as important or even more important than actually doing the moving part. So here we go. So I'm a physical therapist. That's what I graduated from. Rosalind Franklin University. That's in North Chicago, next to the VA. Yes. So the vision statement of the APTA, American Physical Therapy Association, is transforming society by optimizing movement to improve the human experience. That sounds like a lot of, fancy lingo, fancy language, but that's their vision statement. But how can it help you? How can it help me? That's from their statement. This is what I'm saying. It can empower you to take control of your pain and, most importantly, take control of your function. Function over pain is what I usually tell my patients. So I like this. I don't know if anyone's seen this before. Doctor, it hurts when I touch my shoulder. Okay, doctor says, don't touch it. That will be $60. Thank you. I really wish it was that simple, right? We all wish it was that simple, but this just leads to the segue that pain is really not that simple. So a lot of, again, remind me too afterwards, we can have a sign up paper, or I can take down everybody's email, so I can email this PowerPoint because it's going to have all the exercises and all the information. So use it as a resource and you can refer back to it whenever. So quick back facts. This is from the British Journal of Sports Medicine. This is well researched, okay? It's not a single study, it's multiple studies combined. And I wrote down, there's 10 of them on the right, so you can refer to that on your own, but I wrote down some of the ones that I like on the left. Okay, first one, persistent, okay, and I chose back pain because 9 out of 10 people are going to experience some form of back pain in their life. It's the biggest form of pain that we see in the clinic and in everyday lives. People go to the hospital for it. People go to the hospital for it, and people end up on narcotics or really heavy drugs just to deal with their back pain. So back pain is huge. So number one fact, persistent back pain, or sometimes we call it chronic, I like persistent better, is rarely associated with serious tissue damage. Number two, scans, so x-rays, MRIs, things like that, rarely show the cause of back pain. Number three, pain with exercise and movement does not mean harm or damage. Number four, back pain is not caused, this is a common myth, back pain is not caused by poor posture. And then another one, pain flare-ups or an acute flare-up of pain, where your pain, suddenly increases, does not mean you did harm or damage to your body. And the last one that I wanted to highlight of those 10 is injections, surgery, and strong drugs are usually not a cure or not the cure for your back pain. Now, that's a lot to take in. And a lot, we can go off of that. And I think I talk about this with my patients all the time because I think it's super important. So any questions that come along the way, again, you can use me as a resource, shoot me a text, give me a call, shoot me an email, anything. Or do your research on your own. That's probably what I'll advocate more than anything about those back facts. And again, the last one I probably want to talk about a little. A lot of patients ask me, should I do back surgery? I've been in pain for so long. Should I get surgery? And the first thing I'll be honest with you. Back surgery is like flipping a coin. It's 50-50. It could either help you 50% of the times, or you can have complications for it and you had this whole surgery and then you still live with back pain. So that's what the statistics show. It is closer to 50-50 when it comes to back surgery. And that is different from getting something like a knee replacement or a hip replacement. And in general, knees and hip replacements do very, very well. So that's in contrast to back surgery. Okay, so we talked about how imaging or scans like MRIs and X-rays don't usually point to the cause of pain. But these are what I call red flags for back pain. Okay, so if you're having any of these things along with your back pain, or that started because of your back pain, then it's a good idea to talk to your physician and see if you can get an imaging or a scan. So in general, if your age is over 50 years old and you have unremitting night pain. So I left that in black because a lot of us and a lot of people I see are over 50 years old, and a lot of people have night pain. Doesn't necessarily mean it's a red flag. These other ones are important and you can keep this. But if you're starting to have bladder dysfunction, if you have a history of cancer, if you have a history of using corticosteroids or your suppressants of your immune system, history of trauma, so if someone hit you in the back with a bat or you fell, saddle anesthesia is basically in the saddle area. If you have any changes in sensation in your saddle area or in your groin area, or if you have sudden weakness in one leg or both legs, if you have unexplained weight loss, recent infection, or fever and chills, those are the red flags of back pain, and those are the things you need to tell yourself, I might need to see my physician and get something done. But in general, back pain is more complex than looking at an MRI or an X-ray and saying, that's the cause of my problem. I like showing this. I don't know how well you guys can see the numbers from there. Again, you can refer to it when I send you the PowerPoint or the PDF. This basically shows the instances. Has anyone here, let's raise our hands. Has anyone here gotten an X-ray on their back or anything? Raise your hand. Okay, that's actually less people than I thought. Has anyone gotten an MRI? MRI? Nice. Okay, the same amount of people that got X-rays. So X-rays in general show bones. MRI show our softer tissues like ligaments, tendons and muscles and discs and things like that. So what this shows is as we age, the percentage of people that have disc degeneration, so discs are the things that go between the vertebrae and our spine. There are cushions in our spine. Disc degeneration, disc height loss, disc bulge, disc protrusion, spondylolisthesis, these are all fancy things for saying there's something different about your back compared to a person who doesn't have a disc bulge or disc protrusion. So basically what they did a huge study where they took a bunch of people with no back pain. Again, these are people who do not have symptoms of back pain, and these are the results they found. So I think something that's important to point out, if you're over 50 years old, you have an 80% chance that 80% of the people over 50 years old had disc degeneration. 73% of people over 50 years old had disc signal loss. 60% of people over 50 years old had disc bulges. 36, 38, 40% of people over 50 years old had disc protrusion. Okay, so these are what MRI shows. And again, these are people without back pain. Okay, so that goes to show that a lot of these degenerative image findings are common in asymptomatic individuals or people with no pain. They are part of the normal aging process rather than something pathologic or serious that requires intervention. So I think it's super important to talk about pain neuroscience. It's basically where pain research is right now. First thing, the longer you're in pain, the less likely that there is actual tissue damage. Tissues heal. Okay, so within 6 to 8 weeks, an acute episode of back pain should heal. So whether it was the disc or whether it was the muscles that was strained, you give the body time to heal. That's what it does. Whether you are 10, 20 years old or whether you're 90 years old, the body has the ability to heal on its own. So the longer you're in pain, the less likely that there is actual tissue damage. Second, pain is a super complex experience, and it is biopsychosocial. So what does biopsychosocial mean? So biological factors of pain include the bones, the ligaments, the tissues, the discs, the muscles. The psychological factor of pain is stress, anxiety, depression. The social aspect of pain is work, relationships, who you're with, and where you are. So what does that mean? It means pain is not just about anatomy. It's not just about my muscle. It's not just about my bone. It's also the psychological factors that either can help with your pain or make it worse. And then also the social factors that we just mentioned right there. Third, and I think if you were to take away one phrase or two phrases, this would be one of them. Hurt does not equal harm. So can I have everyone repeat that? Hurt does not equal harm. So just because you're in pain, which is what hurt is, it does not mean you are damaging or you are harming your body. And this is another great one. Pain is not a fact. Pain is an opinion. So basically, pain is an alarm system. That's what it works as. And it's with any alarm or danger signal, your brain has to interpret that signal. The brain has to interpret how much danger there is, right? Did I break a bone? Did I sprain something? Did I strain something? The brain has to interpret that. I always say, no brain, no pain. So if you don't have a brain, you will not experience pain. So what does that mean? So a danger signal, no brain, no pain. So a danger signal, so analogy I like to use is if you see a fire, right? To us, that screams danger, right? We're scared, we'll probably run away from it, we'll do whatever we can to run away from it, probably, if it's a big enough fire. But what is a fire to us compared to a fire to a fireman, right? When we see fire, we think danger, and a fireman sees fire, he also sees danger, but he is well equipped to handle that danger. So he sees it a little differently. He's less stressed about it. And it's not as fear-inducing as if we see fire. Same thing as a robber to us or a robber to a policeman, right? So pain, the signal of pain and danger has to be interpreted by us. And if we don't understand pain, or if we don't understand these things, it will seem scary, it will be fearful for us, but the more we understand the pain, right, the better we are equipped to handle and control it. And this is going to be long-lasting effects. Aerobic exercise, which means getting your heart rate up through exercise, has been shown to stimulate the brain to release endogenous opioids. What are endogenous opioids? They're what we call endorphins, which are your natural painkillers, right? As much we take Aleve, we take Advil, we take Tylenol, those are painkillers, but our brain has the ability to release natural painkillers, and those are called endorphins, and those are released when we complete or when we perform aerobic exercise. It's kind of like we have what we called a runner's high. So runners get this high feeling when they run, and that's actually not just a metaphor, it is actual physiological response of the body. When we're in aerobic exercise, we get this high feeling or this no pain feeling when we do something like aerobic exercise. I like showing this picture to my patients. The first picture this is a 15, 16-year-old gymnast who's suffered from back pain ever since because she's a gymnast. And just because you're a gymnast doesn't mean you have back pain, but she had back pain. The first row is her not moving at all, so her brain is not firing, right? Again, no brain, no pain. No brain, no pain. The second one is they ask her to do a movement, extension, so bringing backwards, and then her brain starts to light up and say, hey, look, I'm interpreting this as a danger. I'm interpreting this movement as pain. I'm interpreting it as a very dangerous signal. And the third row is after they taught her a little bit about pain neuroscience, what pain is, thinks that you can handle it. And as you can see, the red parts is where the brain is firing. It's still firing. There's still red signals, so she's still having pain. But what's the difference, right? There is significantly less firing of the brain and less stimulation because she knows a little bit about pain. So giving someone education about pain and then getting them to move is really the end goal. So again, hurt does not equal harm, those things. And you tell them that, and you have them perform movements and exercises, and their brain will not interpret the danger as intense or as fearful. We're almost there. So persistent back pain and other types of pain. Persistent back pain or chronic back pain that's longer than 3 months is what I would call it. It's most likely due to a sensitive or an overprotective alarm system. So what does that mean? Again, I said pain, or it's about an alarm system, right? An overprotective alarm system is like we have homes. Some of us have alarm systems, some of us don't. But an overprotective alarm system, to me, the analogy is like someone breaks your window. Of course, the alarm system's supposed to go off, right? Someone throws a baseball and it breaks, or someone's trying to break in, the alarm system goes off in your house. Right? An overprotective or sensitive alarm system is if a leaf or a branch brushes the window and then the alarm in your house goes off. It's not supposed to, but since this alarm system of your house is sensitive or overprotective, it is firing and going off even though it is not supposed to. That is most likely the cause of what they have shown to be the cause of persistent back pain. So it's not an anatomical issue. It's a sensitivity issue. So another thing, arthritis is a normal part of aging. I have to tell this to almost every single one of my patients. Well, of course, unless they're 10 years old. I tell them arthritis is a normal part of aging. I say it's kind of like we don't question why we get more wrinkles on top of our forehead, but we do question, why do I have arthritis in my knees or in my hips or in my back? But it has shown to be 40% of people that have knee arthritis don't have pain. So how they do this is they take an x-ray of 100 people with no pain, or maybe thousands of people with no knee pain, and they take an x-ray and it shows 40% of them actually have arthritis, but they don't have pain. So arthritis is a normal part of aging. The key to kind of attacking some of this persistent back pain is what we call graded activity / exposure and progressive overload. That's a really fancy way of saying do as much as you can right now, do a little bit more next week, and do a little bit more next week. So exercise and movement have to be part of our daily lives. What I tell my patients is we don't question, well, we do question, why do I have to brush my teeth twice a day? That's to protect your teeth, right? And it's the same thing with exercise and movement. We are meant to move. We are meant to stimulate and strengthen our muscles. Our muscles are our primary protectors of our joints. If the muscles are not strong enough and we're not moving enough, we're probably going to have some pain or some ache. And a lot of the injuries that I see, or some of the pain and daily aches that I see, is from two things. Not everyone fits into these two categories, but one is from doing too little for too long, or it's from doing too much too fast. And I think, to be honest, a lot of America, or a lot of people, fall into the doing too little too long. That's why they're having pain compared to the too much too fast. Of course, we get too much too fast people also, but a lot of people are in pain and aches because they're doing too little for too long. Let's put this. If you could take away anything from today, it'll probably be this. The hurt does not equal harm, and then this. The goal should not be to eliminate pain. The goal should be to control your pain, and the goal should be to improve your function. And I tell this to all my patients, especially if they've had persistent back pain or persistent pain. It's not to have 0 out of 10 pain 24/7. It's to be able to manage and to control your pain, and to be able to improve your function. And function means what you do on a daily basis, right? Sleeping, standing, sitting, standing up, walking, jogging, those things. So your daily functions. And probably my last one, yeah. So why do we have to exercise? I think we've come to a consensus from sports medicine and things like that, they recommend 150 minutes a week of moderate intensity activity. Moderate intensity activity is anything that gets your heart beating faster. So we're thinking 120, 150, 150 beats per minute if you're measuring your heart rate. Why do we have to do that? Because exercise has been found to reduce the risk of what we call all-cause mortality. All-cause mortality means death. So all-cause mortality is any of the diseases or preventable diseases like diabetes, hypertension, obesity. Those are all-cause mortalities, or coronary artery disease. Exercise has been found to reduce the risk of all those things. And then I'll leave you also with this. The person who goes from no exercise, so 0 minutes of exercise, and they go from 0 minutes of exercise to 5 or 10 minutes of exercise, is actually significantly decreasing their risk of all-cause mortality compared to the person who's already exercising 30 minutes and then they bump it up to 40 minutes a day. So that's good news, right? You can go from no exercise to 5 or 10, even just 5 or 10 minutes of exercise, and reduce your risk of all-cause mortality by significant amount. So I think now is a good time. We got less than 30 minutes left to go over some of the exercises that we want to do. And Eric is gonna be my demonstration person. And I want everybody to follow along. Again, the one thing that we have in common is nothing, right? Because we're all different. Well, I'm sure we all have something in common, but exercise-wise, not everything is gonna be good for everyone. So if some of these things are like, oh, this doesn't feel like I don't have the mobility for this, there's always ways to, change it up. And that's the hardest part of having a group class, is not everyone is at the same place. So some things are going to be too easy for everyone, and some things are going to be too hard for some people. So again, bear with me. This is a group class, so it's hard to, what's great about physical therapy is it's individualized, right? I see one person at a time. I don't see 2 people at a time. I see one person at a time, and I can tweak the movements and things like that depending on that person. What's hard here is, it's a bigger group of people, so it's hard to do that. All right. All right, I'm going to have Eric. You can have a seat. What, you want him right there? Or you want have Eric sit right here. So for neck issues, this is one of my fundamental exercises that I will show. It's called a chin tuck. Again, I will email this to whoever would like to use it. A chin tuck is basically recruiting some of the deep muscles in our neck, postural muscles, so that it can hold our head in a better position so that there's less tension throughout our body. So as the picture shows, the starting position is slightly forward, or wherever your neutral position is, wherever your neck usually hangs out. And then the cue I give my patients is think about making a double chin. So it looks like this. There you go. Think about making a double chin. Eric, hold it for 5 seconds. It's going to be hard to talk, and then relax. All right, so I want everybody to do this. So you're not tilting your head up. You're not tilting your head down. You're thinking about going straight back and making a double chin just like this. All right, give me a few more, Eric. 5 seconds. 2, 3, 4, 5. And you should feel a gentle stretch here in the back of your neck, and then some of the muscles deep in our neck are going to be engaging. This is a good one, a fundamental for my neck patients with neck issues. So again, you're still looking straight forward, And you're bringing your neck straight back and making a double chin. Try not to tense up your shoulders like this. Keep them down. The work is done with the neck and not the shoulders. One more. Nice. So there's some instructions there you guys can go over. I would recommend 5 seconds, 2 sets of 10 repetitions. We'll go to the next one, Eric. So I want everyone to stand up now and find an open space on the wall. These are called wall slides. Find a flat portion of the wall. If not, just find the best that you can. So again, this might be very difficult for some. So Eric's gonna stand here. He's gonna pretend like there's a wall behind him. All right. So start with like what I call a field goal position. If anyone watches football, keep your elbows and your hands as close to the wall as you can. Start like this, and then you're gonna slide up while keeping your elbows and hands back. You're gonna squeeze those shoulder blades back as you slide up and down. So you're gonna feel those muscles behind your back working really hard.
Try to keep your elbows and hands on the wall.
Yes. So not everyone's going to be able to do it. Again, this is a very difficult, it can be very difficult depending on who it is. We're going to do it. Let's get 5 repetitions all together. Ready? We'll make this a group fitness class. Ready, set, up, down. So squeeze those shoulder blades back, up, down, 2, up, down, 3, up, down, 4, up, down, 5. So that's about 5 repetitions. That can get very difficult very quick. So if you're having upper back stiffness or neck issues, this is a great one for you. If you're he needs a side. That's what Ninos is there for. So again, this is not every one of these exercises for everybody, but I'm giving someone, a little glimpse of what we would do. All right. So I'm actually have some bands. Does anyone here want to raise their hand if you have like a shoulder issue? Like a specific, oh my goodness, that's a lot of people. Right there. Oh, I can see. I even just see James just trying to lift his shoulder. So if you have a shoulder issue, come over here, grab a band.
I'll come around.
Oh, okay. So orange is the easiest. Huh? Well, let's see. Everyone can do this, but I want the people with the shoulder issues to take a band. We can do sitting on this one, Eric. Orange is the easiest, green is medium, blue is the hardest. All right, Dave, I realize, leave one for Eric to use. This one you do. Oh, you can go back. Let's go back to our seats. Sorry. I realized we were all standing on the wall. So I call this, or we call this, sorry, a lot of PTs, we call it no money because it looks like you're signaling, I have no money. So Eric, you are going to keep your elbows. We're going to watch Eric do it first, okay? You're going to keep your elbows by your side. They're not going to flare out like that. And you're going to pull the band apart nice and slow to where you can go and then come back. So here, you're going to feel some of your, we can all do it together. Let's do 10 repetitions together. We'll follow Eric nice and slow. Okay, pull apart, keep your elbows together, or keep your elbows by your sides, and then coming. Nice, Mr. Budin. So these bands are very, 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 very cheap if we get them online. David is going to go around looking at form. Nice. So this, you're supposed to feel on the outsides of your shoulders. This is going to work your rotator cuff muscles. The stronger your rotator cuff muscles are, the more healthy your shoulder is. Nice. So everything nice and controlled. Like the pace that Eric is going is perfect. That's a good pace right there. So I recommend 2 sets of 10 to 15, depending, right? So if you want, if one set of 10, so one way we can progress it is pull the band in closer, or get closer to the band, or make the band a little farther to make it easier, right? So James just made it harder. Yeah, choke the band a little bit. Exactly. So Eric, place his hands closer. Okay. Again, it's hard to, individualize. So here, all right, time to use our yoga mats, everyone. You can keep that band. That's for you to keep. Again, they're very easy and cheap to find on Amazon or wherever you would like to buy those. You just call them TheraBands or what they're called. You can always ask me. All right. So all those people that responded back pain, we're gonna do some easy back movements. All right. So Eric, let's hop up on here. You trust it? You trust this table? You're matching with the table here. They can keep it. I'm giving it away. I feel like Oprah. So Eric's going to bend his knees a little bit more. All right. Is everyone ready? Whoever wants to participate in some gentle low back stretching and movement. So one of the things I tell my patients is motion is lotion. Can you say it? Motion is lotion. And that's not just a phrase. It actually means that when you are moving your joints, you're introducing lubrication and oil and synovial fluid into your joints. So when we move, we lotion up those joints. So Eric is going to bend his knees about this much, and he's going to go side to side, what we call wig wags or knee rocks. Eric might feel like he's going to fall off the table, but I don't think he will. So this is a gentle way to get our low back rotating and moving, and also the hips as well. So you're going to do 10 repetitions. Side to side is 1 repetition. You're only going to go as far as you can do. So everyone's going to be, some people are going to be stiffer than others, so you don't need to go all the way to the floor. Good. Nice. So I can already see which people are a little more flexible and which people are stiffer. But anyone and everyone can benefit from this. Nice job, Eric. Yes, nice and in control. No crazy swinging. Nice, Uncle Carmel. No, your feet, sorry, your feet don't have to stay down. They can just roll from side to side just like you're doing right there. So yeah, see how Eric's feet are turning to the side just like that? So that's fine. Your feet, you don't need to stay on the ground. All right. Again, another one that not everyone is going to be able to do. It's called the child's pose or the prayer stretch. Huh? So if someone has really tight hips and knees, you might not be able to do it, and that's okay. So Eric, good. Let's see how stiff Eric is. You can spread your knees just a little bit. It depends. There's different ways to do it. And then sit back your butt into your heels of your feet. As you leave, yes. And this, you should feel a good stretch on your lower back. Yeah, so think butt to knees, or butt to heels. Nice. So it might be difficult. That's why. And if it helps too, you can spread your knees a little bit. Oh, when he kneels down? Oh, okay. Does anyone have here something soft? So, yes, a yoga mat or a pill. Like you could do this with a pillow. At home, you more pressure on the knee. So again, this is not for everyone, but if someone was having if someone was having back issues, so do not force yourself into doing this if you feel like you don't have the mobility. There's other exercises we can do. All right. Again, not all exercises for everybody. So if it helps you move a little bit better and feel a little bit better, then I would definitely recommend it. So another one that might be difficult for a lot of people, but overall is a great stretch. It's called a press up. So this is not a push up. Okay, you're gonna start on your stomach. And again, depends on how everybody feels. You're not going to be able to go as high as she does, but Eric, go ahead, press onto your hands. So try to keep your hips down. So if it's too hard, move your hands up and keep your hips down. Bring your hands forward, and if it's still too hard, then you can use your elbows instead. So go up onto your elbows instead. There you go. So you can, Eric, go into your elbows. So that's less intense of a stretch, and that's okay. And then relax into your relax into your hands, and then push up with your elbows again. So if anyone needs a reference, Eric's doing a good job here. So of course, if you're having wrist issues, if you're having hand issues, if you're having shoulder issues, this might not be the exercise for you because it might be too difficult, and that's okay. That's okay. There's plenty of other things that you can do for your lower back. So I recommend 5-second holds 10 times. Nice, Uncle Paul. That looks pretty good. He's pretty flexible. All right. Now time. So those were the stretching / mobility. Now we're time for a little bit of strengthening. This is what everybody needs to do more of. If I was to recommend one exercise out of all of these, it's going to be squats. Okay? It's the best, what we call bang for your buck exercise, because it addresses so many things all at once. So Eric, if you could see how she does it, she's going to have her arms in front of her for a counterbalance. Good, and you're going to stand up and sit down. So we're going to do, all of us, whoever can, we're going to do 10 of these. So find a chair if possible. The chair is a good indicator of our butt going back. So think butt back and then forward. Butt back and then forward. To make it a little harder, instead of sitting on the chair, you could either do it in the air like James, right? James? Yeah, right. Like you could do it in the air like James, or like at the floor is doing, or you can just tap the chair and then come back up. You can tap the chair and then come back up. And if it's too hard to tap the chair, then you can sit all the way down and then come back up. Okay, yeah, so again, if you're not used to it, and this is probably, like I said, so one thing is don't let your knees cave in. Don't let your knees cave in. Keep them out. And butt back and then up. Butt back and up. Good. This is going to strengthen the knees, it's going to strengthen the hips, and it's going to strengthen your core. All right. Again, if I were to take away one exercise, it's going to be this one, okay? All right. Back on the mat. I'm sorry. I probably should have ordered this a little better. Back on the mat. So now we're really going to move.
And then let's give a standing, an alternate standing one. Tell only to do it standing. I'll show them.
Okay, David's going to show a way you could do this standing.
Lay down, you can do it standing, okay? Put your hands on the chair. Or stand behind your chair.
All right, this might be the hardest for some people. Okay, but this should not the pain or discomfort you're going to feel is probably from your muscles working again. Okay? So you're going to roll your hips forward, Eric. Don't let your hips roll back. You're going to bring the legs slightly behind you and you're going to lift up and down. So Tita Ivan, like this, up and down. You should feel this on the
If you're standing, still go back a little bit. Don't go forward, okay? Go back a little bit if you're facing this way.
All right, let me take a quick look at how everybody's doing. We're not thinking of going as high as we can, so that's probably a little too high, Tita Glow. So keep the legs slightly behind you and not in front of you. So right here, okay? Yep, good job, Tita Ivan, that looks good. Tita Hilda, try to... You can keep your hips rolled a little bit more forward. Bend this one. Yeah, bend this leg. Yeah. And you're gonna go here to here. That hurts, or is that difficult? It's gonna be difficult. This is not easy. Of course, we're gonna do both sides if you were to do it at home. Even if you only have pain on one side, you should always do exercises on both sides. Huh? All right. Our time is winding down. We're almost there. All right, only 2 more left, guys. 2 more. We're almost there. Let's go back onto our chairs. So who here has knee issues? Knee? Mr. Badin, we talked about your knee. Tita Lita? All right, I'll give us some time to... So whichever knee you are going to work is going to be slightly, what we call a little straighter than the other one. We're going to go onto our chairs. So choose a knee, whichever knee that you want to work on today. I always recommend doing both. And you're going to, so this chair is a little high for me, but it's okay. Those chairs should be good for you guys. And you're going to kick up, squeeze this front of your thigh, and hold it for 5 seconds. 2, 3, 4, 5. As straight and then squeeze that muscle. Ready? Go. 2, 3, 4, 5. So you should feel that muscle in the front of your leg start to get tired by the time you do 10 of these. 2, 3, 4, 5. Again, you're trying to squeeze that muscle. It's called the quadriceps or the quads. This is hard for it's hard for the chair is not deep, or it's not deep enough for him. But so if you raise, you should do your best actually to relax and you're not doing this. Yeah, you're doing this. So from here to here. 2, yep. Yes. We will do. Again, this gets like I said, motion is lotion. Oh, the toe should be pointing towards you, towards you. That's going to help you activate that quad a little better. And it's a good stretch for the back of your leg, like my sister was saying. All right, a little bit of balance, which everyone can use. We're going to stand up. Find a chair, or if you don't need a chair, you don't need it. You'll probably know right away, can you hold balance on one leg? So if you right away you know you can't, you're going to use that chair in front of you. So if you need the chair in front of you, you can go behind the chair. Eric will show it. You're going to lift one leg and you're going to hold your balance for 15 to 30 seconds. All right, everyone? Okay, everyone put their foot down. All right, lift their foot up and we're going to all hold it for 30 seconds. Ready, set, go. And you're going to try to, let go as much as you can. Obviously, don't fall over. I don't want that. So if you need to, Uncle Carmel, let's see if we can Uncle Carmel, can you take your hand off the chair? Can you take your hand off the chair? I think it has been 30 seconds. Huh? Well, then how about on the other leg? Right? Good. So, again, ways to make this easier or harder. All right, we'll go for a way to make it easier. How can we make it that easier? Is there anyone real quick, I'll quiz the How can we make it easier? Go ahead. How can we make that easier, Keanu? Holding on. Yes, but if that makes it too easy, another way is do heel to toe, like this. So instead of just one leg, we're going to do heel to toe. One foot in front of the other. It's a balance exercise. And it's good for your ankles. That's one way to make it slightly easier. Yep. One way to make the single leg balance harder is by moving and doing these. That's one way to make it harder. So again, some things are going to be harder for most people. Okay, yeah, make it easier. So here, this is also hard. Going from here and rotating side to side. That's another way to make it harder, okay? So again, it depends on each person where they're at. All right, real quick, with the couple minutes that we have, does anyone have any questions maybe? We'll take maybe a few questions. Oh yeah, let's go. Let's sit down. Roll up our mats. Does anyone have any questions? We'll shout them out loud. When are we doing this again? I don't know. I think I'll leave that up to David. I thought this was super fun. So yeah, give everyone praise God that praise God. I'm so thankful we got to do this again. What were you gonna say? Twice. So yeah, we could do this twice a year or even more. It depends on what everyone's availability is. So again, okay, Uncle Benji. More exercises? Well, okay, so again, this is where you can use me as your resource, since you guys know me and I know you. You can tell me, can I have more specific exercises for this? And then I'm okay with giving you guys a little bit of advice, showing you a video, giving you some pictures. And all right, and then the emails will go to David, so I can send this PowerPoint to whoever would like it. Again, that first part is a lot of information. It's great knowledge that we can take away. Yes, good tea. I think core exercises are great. We did not have time to do one specific core exercise. So maybe, Eric, real quick, we'll do one quick one. Go on your back with your knees bent. All right. One way to strengthen your core is think about someone's hand being under your back. And Eric, what you're going to do is think of squishing my hand with your lower back. Good. Give me 5-second hold. 1, 2, 3, 4, 5. And relax. Do you feel that working some of your core muscles? So that's an easy one to do for your core. So think about someone's hand being in your back. You're going to squish it. Good. 3, 4, 5. And then you're going to relax. One way to make that harder, I don't have this, by the way. You can always reach out to me. Squish my hand. So keep my hand squished. You're going to lift one leg. Keep my hand squished. Okay, Eric? Lift the other leg. And then bring one leg down. And bring the other leg down. And relax. Good. So when you're relaxed, our back has a natural arch to it. When we engage those deep core muscles, our back will flatten. Go ahead. I don't know if everyone can see that, but you can see his back flatten. You're going to go up, up, down, down. So can we keep our back stable and engaged while we move our legs? That's the key to that exercise. That's just a little glimpse to that exercise. Okay? If anyone ever tells you, whether a physical therapist, personal trainer, or doctor, that an exercise is bad for you, do not listen to them. No exercise is bad for you. There's just some exercises that you're not ready for, that your body might not be ready for, but there is no exercise that is inherently bad for you. Okay? So again, there's exercises that you might not be ready for, but no exercise is bad or damaging for you. So feel free to explore with some of the exercises, whether you see them on YouTube or something. You can always try them. They're not, again, you'll know right away if you could do them or not. They're not bad for you. You might not just be ready for them. And there's a lot of things you can do to prime your body or get your body to a state where you can be ready for a more advanced exercise. Okay, any other questions? I'll take maybe 1 or 2 more, unless we got to go. So I like that question. When can we do it again? That's great. All right. So again, we'll take your emails and we can send this PowerPoint. Uncle Benji wants more exercises. He didn't think this was enough. Never know. That's right. So again, our general recommendations for exercise is you got to be moving and get your heart rate up 30 minutes a day, 5 times a week. That's 150 minutes a week. Or if you like really intense exercise, like running, jogging, basketball, sports, and things like that, you only have to do 75 minutes a week of vigorous exercise. Compared to if you were doing a brisk walk or a jog or an easier exercise, you have to do 150 minutes. That's for overall heart, cardiovascular, and lung health. Okay, that's it. Again, praise God. I'm open to answering individual and specific questions. David will probably send you my email, or I will send you my email. Basically, it's my first name, last name at gmail.com. JedidiahNulud@gmail.com. You can reach out to me there. All right. I'll close this in prayer real quick. Lord, thank you so much for this day. Thank you, God, so much for this opportunity that we haven't had before. And we just want to thank you and bring and give all the glory back to you. Lord, we know in the end you are the ultimate, and you are the healer. You are the physician in our lives. Thank you for giving us bodies that are resilient, even though we have our daily aches and pains, God. Remind us and help us to move a little bit more to take care of these bodies that you've given us. and to glorify you with the bodies that you've given us, and to stay healthy, and also to encourage each other to stay healthy and moving as well. Bless us as we go our separate ways, Lord. We give you the glory in Jesus' name. Amen. Thank you, everybody.